החברתי הראשון.
Good morning from Israel. This is us building the future the Israeli way, and today we have a special guest and a dear, dear friend of mine after, of being a patient of her for a long time. And this is Dr. Monica Elman, which is a specialist in dermatology and laser aesthetics treatments. And really, we are going to talk about the game changer in aesthetic treatments. This is our topic. And I think that you should relax, take your cup of coffee, and indulge with us in a wonderful conversation that we are both going to have. So this is Monica.
Hi. It's very, very good to be here, and I'm very happy. And I think that this is an opportunity to share our experience in the last 2 decades of what we did and what we are doing and what we see as a future in our field.
Brilliant. But Monica, can I take you for the beginning? Can
Yes.
I take you back to the beginning? I know that you grew up in a house of doctors.
Yeah.
Can you tell us a little bit about your background and what brought you to the
Yes.
profession? When did you make the decision to become a professional in the medical field, and why this domain?
Me and my husband, we came from families of doctors, and practically many years ago, when you think to be a doctor, it's something that's not only it's a special way of treating people, but you need to, in my opinion, you need to have also to be very understanding and to be very cautious when you treat people, because people are not a number in the computer. And in the many years, we understood that it's to treat also the soul of the people and not only the people. And when I decided to be a doctor, it was when I was 5 years old.
Wow.
Yes.
That's old.
Yeah.
You waited a long time.
And I, after the military service, I started my med school in Milan, and it was a wonderful era to learn a wonderful place to change my mind about how to study out, not in the field, not in your area near home. And it was an experience that I think that gave me a lot of perspective how I want to do things in life, with a lot of thinking about how we should look like, and what you're eating and what you're going to do with your skin, without think that I'm going to be a skin doctor.
Really?
Yeah, and when I start my internship, usually you don't know what you want to be.
How old were you?
I was 27 years old when I finished school, med school, and then I thought only to go on something that is very surgical, and I made an elective in the Sheba Medical Center, and I went to see what is dermatology, and I combined it with dermatologic surgery, and then I decided that this is going to be my way. And
how come? I mean, probably you had so many opportunities, and I'm sure that you were a brilliant student, so you had many offers. How come? How come did you choose this of all the great opportunities that were laying before you?
It was very. I want only something that is very surgeon, but when I saw the combination that and I didn't have any things or thoughts about aesthetics. It was something that was started because in those periods it was I saw many things to treat. It came later. So when I was in the middle of or in the end of my specialization in the Tel Aviv Medical Center, and I saw, for example, the first laser that came to Tel Aviv Medical Center, and it was something that changed my mind to think something else. Because when you think of a normal department of dermatology, you see a lot of skin problems, and you see something that it's not so nice, and you understand that maybe you can change something, but it's coming. It's not coming immediately. It's come when you understand what you can do, and you understand what is the skin, and practically the skin is the organ, the big organ that we have, and a lot of things you see on the skin. It's not something that you see. I feel that for example, I had pain. Sometimes the pain is on the skin. When, for example, people have problem of the skin, like eczema, like atopic dermatitis, you see it. But and usually when you see it, it makes you very, very sad and very angry, because everybody is gonna see it. And at the end of my specialty, I thought that I need to change something. One, to be a dermatology, classic dermatology, but how can I improve? How can I improve the skin texture? And what can I do with this? Is technology, is combination. And it was very at the beginning, because we are in about 25 years ago, we have been a very few doctors that understand that we need to think out of the box.
So what you're saying is that it's not only you say, this is my profession and this is going to be my passion, but on top of it, what you said, if I may say, that there is a huge opportunity for change and simply, I would say, progress rapidly using different kind of technology in order to really reshape
when you say
profession.
Yes, and not only reshape the profession, to understand that we have the possibility to change things that we didn't understand that we can do it, and it takes time, because the technology and doctors, it takes time to understand, to make this change in mind, to see that, for example, if I have some insult of the face, I have some pigmentation, I have any problem, how can I treat it? Not only with give you a cream or to say, this is it, we don't have something to do. So we understood that we can change a lot of things. And in the last 25 years, I got involved in being one of the pioneers in aesthetic treatments. This is something that it's not possible to do it during your specialization, because it's not there. They need to understand. Mm-hmm. You need to do a lot of things to obtain to be a specialist in dermatology, but not in aesthetics. This is something that came later on. And when I saw, for example, we have been the first laser clinics in Israel. It took to understand, how can I improve what I see, and what is gonna be, and what I can explain to a patient, because also the patient, so many years ago, they didn't understand what the technology can do for the skin.
Sophie, if I want to play back what I heard. First of all, you're saying that you have to have the fundamental of the profession. What
exactly.
Does it mean? Okay.
Exactly.
But then you can ask yourself the question, and this is the question, I think this demands a totally different mindset. Well, it's not good enough that I'm doing what, is the legacy process or whatever. Whatever people are doing, what is traditionally is being perceived as, best of practice, or, that you can't do anything. This is, there is no solution. And you said, I want to break down these walls and I would say obstacles in my mind, meaning having
completely.
So I want to look at this now that I have the knowledge. I want to look at the problem with fresh eyes,
and with change the mind. For example. We started 25 or 27 years ago with a CO2 laser, which is an aggressive laser. So it's not only in clinics in the hospital. It was something that went out from the hospital to the outpatient clinic, in a doctor clinic. So we need to think, to change what we can do in a clinic to do something for the skin. So for example, we start for wrinkles and texture, and we started to understand that we can take to make a burn that we understand on which level of the skin we're doing the burn to improve the skin texture.
So it's also reallocation of the treatment, meaning out of the hospital, moving it to the clinic, and then probably you can give treatment to many more people because
Of
it's not that
course.
expensive. Also, people probably will come more willingly because going to the hospital is a little bit scary for some of the
Of
people.
course, all the aesthetic treatment, they are not in a hospital.
Okay.
Hospital will treat things that you cannot have it in an
Brilliant.
outpatient
Which
clinic.
is totally different than what it was 25 years ago.
Of course, and it took time to understand. And then when we start to understand that we can do a lot of things with the technology, while we understand what we are doing in the skin. If we are dig down, we are in the skin, there are level of the skin.
Can we just, before that,
Yeah.
Monica, we talked before we started that people don't really understand what is the skin and why the skin health is so important. I mean,
Yeah.
can you just tell, because
Yes.
people don't know. I don't think people are talking about or thinking about. People are talking about the brain and about the
Yes.
heart. No one is talking about the skin.
Exactly.
So I want you to explain to our audience. Yeah.
Think that you have a cobblestone, okay? A cobblestone that you have, for example, we have the epidermis, which is the upper part of level of the skin, and we have the dermis, and then the underdermis, and then we have the adipose tissue, the fat tissue, and then we have the bone. When you have all this, when we are very young, everything is very elastic, and the texture of the skin is very, very nice. But with time, things are changing. You know, for example, when we are 20, we have a change in our collagen. When we are 30, we are losing 5 milliliter every year
Wow.
of our adipose tissue. It means that our skin is changing because everything is changing. Our mastication, how you live, in which atmosphere you're living, if you have a lot of pollution, which kind of life are you are doing. So all these are very important with what happened to the skin. And so for example, we're closing and opening the eyes 250,000 times a day.
Wow.
So of course we'll have
Wow.
big wrinkles because it's something that is biologic. So understanding what's going on, or for example, the mastication. When we are eating something, we have to press the food, so it's about 30 kilo that every time that we're eating something. So a lot of things are happening on our face and on our body. And people in the last 25 years wanted to look better because life longevity was changing. The medicine was changing, understanding were changing. So we wanted to look much better. If I'm looking at people...
And also may I, remind our listeners that, because you taught me that the skin is the largest organ. Yes, okay. Yeah.
And he remembers. When I say remember, it was something that we...
The skin remember.
The skin remember.
Wow.
It was something that we were on the first day, I think, in the specialty in dermatology, told us, you know that the skin remember.
Wow.
We didn't understand. Because when you're very young, you're going to the sea and you get very tan and you say, wow, it's so nice, it's so sexy. But years later, you'll get pigmentation, you'll get the skin thinner, you'll get the pores will be more open. So we harm
smoking.
But we have a lot of pollution, and it's not even you won't smoke, but you have a lot of pollution in your area, and sometimes all the things that we have in our environment can be very harmful, but we cannot change on us. Not only to change environment, it's something very big. So people must understand that it's influenced the skin. So what we can do, it's to take care of our skin, to stay away from the sun, or if you're going to the sun, put sunscreen, and don't be outside in very hot hours, because Israel is a very hot country. You can see we are start December, it's summertime. So living in hot places, not only in Israel, all over the hot places.
And it seems that they're going to be more like this, unfortunately, because of the crisis.
There is a change in the color. The changing in hot weather is changing the color in yellow.
Wow.
In all the countries that is very, very hot. So understanding this, it's, first of all, take care of your skin. it's something very important. Before we start to understand what we can do with the technology, with the knowledge, and the combination things. And during this after specialty, and while being a very dermatology, very conservative dermatology in what we need, but I was very open-minded to combine it with treatment. For example, we have been a couple of times official FDA site, for example, for laser hair removal. You know that hair is something that's very disturbing. There are people who are suffering from hyper hirsutism with a lot of hair on the face, usually women, on the body. So it was something that was breakthrough to take the technology to treat something that it's genetic, hormonal, and we did it. I mean, there is not permanent hair reduction, but there is hair removal for years, and you can treat it. What we cannot treat, for example, and I'm very sorry about it, the white hair or the blonde, very, very light blonde hair, because we can have them all. I mean, we can achieve a lot of things, but we cannot achieve everything. So it's about more than 25 years that we can have hair removal, and it looks very smooth and very nice. But for white skin, we don't have any opportunity.
Can you go back, because when we talked before, you told me about the story, what happened with the laser and what they were, how you are pioneers. Can you tell everybody about it? Because I think this in a sense was a very important experience for you personally, because it showed you that things can be done differently. So can you share with us because this was the beginning of the revolution, right?
This is a revolution in aesthetic treatments, when I think that, for example, to have a possibility to try to treat, for example, acne. Acne is something that is genetic, hormonal, congenital. We cannot treat. We don't treat the face as it should be, and a lot of stress, and or what we put on the skin. Sometimes it's not correct to put things on the skin. So, and not only to give medication, because I'm coming from the discipline that if you need to give medication, even a big medication, for example, like Accutane treatment. But before we are giving this, we can improve the skin, and maybe we won't arrive to give so many medications. For example, phototherapy. It's understanding for example, in acne, we have an inflammation of the skin because the acne problem is inside the skin. So if we can reduce, for example, the inflammation with something phototherapy, which is not radiation. It's something that everyone can have it, even if a pregnant woman. So we can reduce the inflammation response of the skin, and this is something that it will be less red and less pigmented.
Why the inflammation is starting in the first place? Is it genetic?
Yes, it's genetic. It's the P. acne, which is something, that 2 kilo of the human skin is fungus and live in our body. 2 kilo of the human being.
So it's not only the skin.
Not on the skin. It's inside, and something which is not harmful. But if we're with if we are losing the balance, so the balance of the infection will go higher. For example, if we're in a very stressful life, so you'll see that all the immune system will go down, and then things happens, and we are very prone to many outside or inside inflammation. So if we can treat something, understanding the cascade of inflammation, we can treat it before and avoid to have, for example, pigmentation, scars, and everything. And then, for example, to take the technology to make a skin smoother, because the skin is aging, and this is something biologic.
Can we just talk about, just for a second, regarding the inflammation? I'm into longevity and the project that I'm doing with Dr. Tiffany Vora. And what we are really learning right now is that inflammation is one of the causes of, unfortunately aging rapidly, using the Harvard clock, you can see that if you have a lot of inflammation in your body, you're probably, unfortunately, much more prone to have cancer and other kind of diseases. Would you like to? So
Yes.
I think people are not aware that if you're taking care of your skin, really you're taking care. Sorry.
Not only the skin. It's very important what you're eating, because people are eating a lot of things that are harmful for their stomach, for example, or for our. You know that in our stomach there is a popularity of. It's like a brain, second brain in our stomachs, and this is connecting to what happened in our life. For example, if you're taking a lot of sugar and you're taking a lot of things that with, for example, if somebody have inflammation, reduce your gluten intake during the day, or reduce the glucose, because it's an energy, it is an energizer. It's give sugar. It's giving to our body a lot of energy. But when you increase the glucose intake, you're harming something else. So the combination, what we are eating, how we deal with our life, influence our skin. And even before treating for aesthetic purpose. So we need to understand that it's very important the environment, what we are eating, what we are drinking, and to avoid things that are not good for our body. Understanding this, we can understand that, for example, if somebody have anemia is something that you can eat very correctly and you will deal with, but something it's inside, so we need to treat it because it's influenced the color of the skin, it influences the immune system. So there are things that are completely medical, and there's things that are completely way of life and way of thinking. And the combination of this is medicine.
May I ask a question?
Yeah.
Is it possible that the I would say the level of health of your skin is also maybe a signal regarding your internal health?
Yeah, of course. For example, when you see that the skin is very pale and you see that it's a little yellow, we need to check if there is anemia, or they have some thyroid problem, or we have a loss of iron, or a loss of vitamin B complex, because all these are very important to the good health, not only of the brain, but all the tissue body.
So it can be that someone comes to you and says, well, I don't like, I have new wrinkles, but then on the way you're saying, listen, I don't like the color of your skin, please go and do.
It happens every day.
Please tell us about that.
Because I say, how your hemoglobin, Say, no, it's, I'm a little under the normal. I say, we see the skin. When you see a skin and you see that the skin is not in the color, and it's not normal, and it's not, people sometimes, they are getting used to the color and don't see the problem of the color.
Wow.
So we are, as skin doctors, we see, first of all, see the skin, watch the skin. Look, not the wrinkle will be later, but we see the pigmentation, the texture. If the skin is very, very thin, if you have a lot of skin problems because of the sun, if you have skin problems because of the genetic or a combination, genetic, hormonal, aging. Before that, we see the wrinkle. The wrinkle is something that it's a loss of skin, which is normal. A wrinkle is something that it's normal. It's biologic. We can treat it. But sometimes we need to treat the skin before we treat the aesthetic of the skin, because you see that there are problems. And I'm not speaking about eczema or acne or some infection or inflammation of the skin. Sometimes we touch the skin a lot, and we harm the skin with what we think, we'll put this and we'll put this, and because I saw it on the internet. And the skin is something that it's say to you, I'm very dry, take care of this. Or don't be very, very nearby an oven. If you like, for example, you like a lot of kitchen to do. So stay away from the heat. The heat is harming the face, not only the sun. When you're going out, you're aware of this. But if you're, if you're open an oven and you have the 240 of all the heat is coming from what you're doing in the oven, it's harmful, and the skin remember. And you see something that you see that its skin doesn't look very nice. So we need to think in both ways. First of all, dermatology, and second, dermatologic aesthetic. This is the combination that we think today.
Monica, so may I say that you have a super computer in your head? No, I'm serious. So when you come and you meet a patient, you're looking as if you're doing a skin scanner
evaluation.
But I'm saying you look all of it, and then you do, and then you make a decision what really is the right treatment. Is this that? Yeah.
And I'll explain to you. When I see patients, usually I'm watching them. I'm not see them. I'm watching them. I'm doing like an analysis, and I see the color, the skin texture, the asymmetry of the face, and how we smile, because usually we are not smiling completely equal. So we'll have pigmentation, sometimes and small wrinkles, because we have some like an insult of the elastic of the skin, which is changing with time. Or people who are doing a lot of gym, so we'll see they have a lot of hypertrophy of the muscle.
Really?
So and a lot of telangiectasia. I mean, small vessel will be open because we need to, of course, we're going to make a lot of sport, so we need a lot of change of the air. So we see the oxygen. So all the bodybuilding and this we see maybe will be very nice for the body, but not for the face. So we need to understand this. Sometimes, yes, I'm doing this, but look your face. And one more thing that it's very, very important: don't chewing gum, because it's gonna increase the wrinkles.
Stop with the chewing gum. Yeah, you want to lose weight? Drink water.
Drink water. and we're doing sport. Do it correctly. I mean, don't you can change everything in a small time in a short time. In the short time, you need to understand that it's a time that it takes time. So, and if we are going through what happened in the last 20 years, I think it was something very special of understanding of the doctors to improve the skin, and the people who understood that, yes, we can change something. And all this technology, which I think that helped us a lot, we understood that you can put on the skin a technology of radiofrequency that can improve the skin texture. First of all, by doing a peel, and to have rejuvenation of the skin, or to make a skin tightening. This is something that's very, very important.
So can you now tell us about, first of all, what I feel, I mean, when I'm looking about your journey, personal. So first of all, you fell in love with medicine.
Yeah.
Then you fell in love with...
No, first I fell in love in medicine, and then in the doctor, because my husband is also a doctor.
Then the doctor.
Then the doctor.
Human incarnation of medicine.
Yes.
Then you fell in love with dermatology, with the skin. And then you fell in love with aesthetic. And then,
technology.
And then you fell in love with technology. So can you tell us about what was the love story? How did you fall in love with technology?
And
what does it mean for you, and what do you do with it?
I think that my journey in technology started many, many years ago. And I, not only being a pioneer of a lot of treatments, and they be very happy to be not only the pioneer, to be able to help the people to be official FDA site and to have articles, but not only this, to understand that we can improve, we can change, we can make something which is something special.
Meaning you're extremely optimistic and also, I would say, patient-centric. And you're looking for personalizing the medical field in your... I mean, you want it to be especially personalized for... So if I'm not mistaken, these are
I think it's very important what you say, because I think that, that, for example, when nowadays we can understand to make a special treatment for a special disease. for example, cancer, for example, biological treatment. I think that now understanding how is working the skin and what is happening in the skin, not only the technology, we can understand what time will be able to deliver into the skin to improve the turnover of the skin, to improve the texture of the skin, and to improve what we need. For example, with time, when you take a blood exam or you take, for example, a swab of the saliva, you can understand on the normal of genetic genetic code of the person, we can improve thinking what we can make that will be very, very special for this person and not personalized. And this is the future, I think.
Are you already working on it right now?
Yes, we are working on this. We start about 7 years ago with a very new technology, which name is Tixel, which is a mechanic heat of the skin. And while we saw that practically we leave slits open for 6 hours, with this 6 hours that the slits are open, we can make a transdermal delivery of ingredients. For example, which is hydrophilic, not lipophilic. We are working on this. For example,
then we'll explain this.
If you are transmitting something that it's hydrophilic, it's water. When with not a cream, when we put a cream, it can close the skin. So if we can, for example, put something for pain to remove the pain, with time, or to take a drug to put it on the skin, and it will in this 6 hours that it's open, this small slits, you can improve the skin with, for example, for pain, or you want to transmit a drug. And this is what we are working now.
Which kind of drugs for which treatment?
For example, like diclofenac, which is Voltaren, which instead of cream or taking it by pill, you can put it on the skin, and it make a perfusion in the skin. So this now it's working in the States.
So it's going to be a different in the impact?
Yes.
Is it going to be long term? I mean, is it going to be for longer, or is it going to be what people are suffering from horrible pain? So this is going to, be a source of...
we would like to make transdermal delivery of ingredients, and now they're working all in Israel and in the States to understand what we can transmit, because the skin is a very, very immunologic tissue. I mean, he can take out what he wants, but you cannot put inside what we want. So we need to be very careful, because otherwise we can harm the skin, and we don't want to harm the skin. So we need to understand which is the level that we can go through the skin with various ingredients, and what the skin will need to have it with an injection.
But it's also it's beyond the health of the skin. This is the health of the whole body. If I'm not mistaken.
It depends, because it depends, because, for example, something that is very old. There's small things that we put for hormonal changes, so you can put like a cream, and it will arrive. But not everything is going to be, and there is, the skin will receive a part of this. It cannot receive everything. When you swallow a pill, it will arrive to other places. When you put on the skin, that you'll have until a level, and under this level it won't go into
Can I tell you what is my metaphor when you're speaking right now? Is that when you're taking a pill, well, the patient, you're totally, I would say, you're receptive, you have nothing to do. This is, you're not a player in this game. But what you're talking about, what you do with the skin, is that your skin, the way you relate to it, is like a partner. So you have to negotiate with him. I mean,
but be very careful, because if the skin is very dry, it's prone for it to be more susceptible to have a problem, because it's dry. So you start to scratch, and when you scratch, it's a port of entry of a lot of problems for the skin, and the inflammation, and things that you don't think about them, because all our environmental is something that you can have. You can do something until a level. So I think with time, because nowadays I think that people understand that they want to live better and to look better and to eat better. So all this is giving us the possibility also to treat the skin problems for aging, for example, because we are aging. And you know that with time, the
Monica, what are you saying? I'm going to live 170
No,
and
of
you're
course.
going to stay with me at least till then because you need to take care of me.
course,
Come on.
of course.
So we have like more than 100 years. What are
Now,
you
I
talking?
heard about 170 years, but we need to change something in our cell because you know what? Our cell with time, the cell, they have a cycle, and sometimes this cycle is start to be very short. We need to increase this.
We are working on it.
I know we are working on this.
Not me personally, but yeah.
No, I think that the understanding today, we want to have a long life, but a good one.
Yeah.
This is something that we understand that even if you see people today, they are living 90 and almost 100 years, but it's very important how you started your life and what you're doing with your life, because the longevity must be a part of way to have a good life and not only a long life.
You know, we are also already starting to age in the womb. I didn't know that. And did you know that, you know, which age women are the most fertilized? On week 32 in the womb, we have 7 million eggs. When we go out, we only have 1 million. It's unbelievable. So yeah.
But a lot of things are changing because of our life, because life today is very stressful, and a lot of stressful life is influence all our body, our hair, our skin, and our body. So understanding that with first of all, understanding that our longevity is together with what you're doing on the skin. And if you're taking care of the skin when you're very young, and why I say very young, because
what is very young for you? Which age?
You know that the FDA say about 15 years ago, start treatments when you're young. So what does it mean when you are young?
Yeah.
If I'm 25 years old, do I need to start with fillers or Botox or something? No. I need, if I need, I'll do it. But this is not the thing. It's the thing to take care of our skin, to what we are put on skin, how you take care from the sun, what you put on the skin, how you take care if you have an inflammation or something, what you're eating, how you make this combination, and to take care of your skin and of your body. This is something when you start when you're very young. Now, if you know that, for example, pregnancy, pigmentation, this is normal. So when to start, when you feel that you want to start, but make a maintenance.
Okay.
Commitment. Because if you make a normal maintenance, skin will say to you, thank you, with time.
Monica, you're very modest, but I know that you have some patent that the FDA approved, and you have some literature that you wrote with some partners, which are right now, you know, a center of excellence in your profession. So would you like to share? I'm sorry, I know you're very modest and you're very humble, but I really think that people should know what a huge combination you gave to the, I think, use, I would say, disruptive or enabling technologies and what they can, you know, the assistance that they gave so many people worldwide. So would you like to share what, you know, the FDA approved and what does it mean and so forth?
So we have been official site for hair removal, for CO2 laser.
It started here in Israel, or was it?
It started in Israel. This is an Israeli technology. We are a huge place of high-tech technology and high-tech nation, and it started understanding that we want to do something. It's not only to make an exit. This is not. It was something that we can give something to the world and to share it with the people. It's not something that you have on your own. If you can share it, give it away. Start to understand that other doctor can be helpful to help the people. And we have been official site for acne phototherapy, or make a peel with radio frequency, with fractional radio frequency. Or, for example, we have been a site for improving the vacuum treatment, for example, to reduce the pain during the treatment, or, for example, to make a skin texture with skin tightening with radiofrequency, and all this, or to take or have pigmentation, and or now this that we are seeing that it's transdermal delivery, not only to make the skin texture better for acne scars or post acne or wrinkles, or to rejuvenate the skin, but to do something that it's a combination therapy. And we have I have a book that I have two books, and one was published. The both were published in New York. One was on the chapter of hair removal. It was about 25 years ago, and 10 years ago, we published a book of IPL. IPL, it's intense pulse light technology to treat a lot of things with two doctors, and
with light.
With light.
Wow.
And it's.
Can you tell us how you got to there? How do you do? Because only now people are starting to talk about treating cancer with light. Can you tell us about how you got to this idea, and what the experiments that you did, and
It's a work of about
because
27 years.
Yeah, but what is interesting about you is that, if I may say, is on one hand you're a real doctor, very having you have 3 clinics, you're working. And until not lately, you were a part of the Maccabi Kupat Cholim, I think one of the biggest institute of
health institute, yes.
But on top of it, you're like a scientist, meaning
I am.
Can you talk about it, because it seems to me that this was the scientist in you that drove you to new inventions. You know
that these things, what we did during these years, the technology that helped the skin problem, is to understand on which level we can improve the skin. It's to understand that if I have, for example, if you have, for example, like a tattoo, not a tattoo that you're doing it in a tattoo place, but for example, for a trauma. So how you can improve the skin with this tattoo, or maybe you have something which is congenital, but people not have it when they are born. They have it when they're 17 or like this. And how you can reduce the pigmentation of the skin with this special technology, and how you can combine, because sometimes you need to combine with 2, 3 technology and not one technology. This is something that it's our work in this years.
So do you have a laboratory that you make all the? I mean, how do you make the experiment?
No, we did experiment because we had on Helsinki. Helsinki is doing treatments with approval of the
You have to do the right.
Yes.
The right research for that. Yes,
exactly.
So clinical trial. Clinical
trial. So this clinic, we are doing also clinical trial all the time, but you don't need, you have the opportunity.
You do it with a team?
I'm doing it with the team. I'm doing it with my team. That, for example, if I want to see if the combination of two treatments, for example, skin tightening and wrinkles, which combination of technology I will do, or which technology and fillers I will do, or what I will put on the skin, because I for example, I have some actinic changes. Actinic is because of the sun. So how can I improve by combination therapy? Because I think that you cannot have only one treatment. You need to combine therapy. You need to understand what you're doing, and you need to make it like a personalized treatment for what is good for you or for me. It's not good for another person. And sometimes you need to be very, very sincere to say something to a person. I can't help you. You know, it's something that it's very difficult for a doctor to say, I can't help you, because we are not, it's not a miracle. It's something that you can say, I can help you until a point. And patient expectation nowadays are an issue. People think sometimes that now we can do everything, we can change everything. It's
miracle
not.
Is in the
It's not
a
miracle.
Yeah,
I mean, what you can do with something that you can change on the computer, this is not real. I mean, a doctor should touch the skin or touch a person, understand, hear what he have a problem, understand if you can help him on a level you can help him, and this must start to be a what you're going to do, a program, and you make a program for this person. And sometimes you need to change something in his life. For example, people need to understand that may have hormonal problems, to treat this, to understand it. It's not that you can do everything because you have a miracle. It's not instant. Many things that we are doing are not instant. So I think
it's a process.
It's
and
a process. And there is a commitment of working, and you need to understand that, for example, the skin is changing once a month. So you cannot do something easier or how to do it. Let's do it in 2 weeks. You cannot do it.
It's a living tissue.
It's a living tissue. And not only a living tissue, it's so personalized. So you need to make a program like a tailor-made, and not something that you're buying like buying a dress on the
and
the
also,
internet.
if I may say, it's not even just it's personal, but it's also different from different. Different parts of my body. I mean, probably the skin of my hands is totally different than the skin of my face and my back and my.
And you know, Yahli, sometimes you can help the face, but you cannot help the hands, because the skin is in a problem of pigmentation, of changes, and you cannot treat. And you say only, please stay away from the sun. Please put some cream.
So what is very interesting is that, you know, we have specialists for the lungs and for the heart, but you're really, for good or for worse, you have to...
A combination.
No, but I'm saying you have to take care of the whole body. I mean,
Yeah.
you're the holistic doctor in a sense.
I think that it's very correct what you say. We are doing holistic work because we are thinking holistic. We see the person as a world and not only his person to take this or to touch that wrinkle. I think that it's something that it's more big. It's more vast.
It's not only physical, it's holistic, also on the emotional and mental.
Emotional, because nowadays, and I think that nowadays, the emotion of the people, not only because we're living in the corona time, which is very, very difficult for a lot of people, and for the world and for the medicine, because we see each other on the Zoom, and important the impact of the people, and only impact of the doctor, impact of the patient. I mean, you see a patient, you see, I'll show you on the media what I have. I mean, it's not personalized. I think that something which is personalized is a better treatment for the person, and not something that, send me a picture and I see what. This is something that, if it's something very now I need to do it, but it's not a treatment.
Monica, you're still running away from my question about your biggest achievements in medicine and in the technology. Can you tell us about something that you're extremely, well, I must say, proud of, or you think Israeli should be proud of, or, you know, we as a nation, and you think that this is also, you know, the starting point for a huge jump, you know, into new things in the future?
First of all, I think that all this year, I remain with the idea that combination of medicine and technology is one of the things that I'm working on in the last 25 to 30 years. And I have still the needs and the want to change and to do something that will
keep
stay.
The spirit. You
yes,
have
the fire. The fire. I needed the name, the fire in the eyes that you see. Yes, we can improve. We can do something. This is something that it's not going away with with aging. It's something that is not okay. I achieved this and that, and I'm well known, and I'm doing this and that.
There is no burnout in this sense.
So there is that we need to continue, and if you have to continue, it makes you younger. It makes you very, very precise, and this
focused on what
and
you
focused. And you need to focus that. Tomorrow it's a new things. Tomorrow it's a new day. Think for tomorrow, not only for today, but learn what was in the past to get better in the future. And
have
this
respect for the history, but still don't let the history and the legacy limit you in your thinking about the future.
I think this is very important. And one thing that I do think we need to teach the new doctors how to treat the skin, because the skin, it's not only the biggest organ, as we say at the beginning.
And he remembers.
And he remembers.
Good memory.
You need to understand that if you want to improve something, because a lot of specialty are going to the skin treatments, you need to understand what you are doing. It's not only to put an injection or a filler or to do something. You need to understand that if you want to reshape the skin, you need to understand what you're doing. Learn the skin. Look what you cannot do. Say you cannot do. Say what you can do. Make a program, and to understand that you have to make a maintenance. But the maintenance is a way of life. It's a way of thinking, and how you deal with not only with the doctor treatment, but what you deal with yourself. And this is, I think, the future of a lot of things. But you need to have the fire.
We have to finish shortly. But I want to ask you, in an ideal world,
there is no like this.
Come on, for a second.
Okay, for a second, okay.
What would you wish if you had all the technologies, right now, I don't know, Jeff Bezos or Elon Musk, whatever, puts you and you say, I'm giving you, an unlimited budget to solve a problem in your domain. What would you do? And that is going to impact 1 billion people. Yeah, I'm putting a lot of pressure on you, but you have no limitation. You can take the best people, you have the best equipment. Which problem regarding, your domain you would like to solve that might have an impact on 1 billion people?
I have two things. One, to avoid scars of the skin, and to get to have the opportunity to treat. They will because it makes scar in the soul. And second, if we can improve the skin texture while they have a lot of thin skin and a lot of sun damage and cancer of the skin or pre-cancer of the skin, if we can treat it personally and to improve instead of having a lot of problems and the skin is changing and a lot of and you have to do surgery, if we can treat this maybe with the technology, maybe with the new knowledge, maybe.
You're talking, the second part was preventative medicine.
Preventative medicine
yes. of the skin.
Yes.
Meaning knowing beforehand that it might have cancer.
Yes, because if we see the start of pigmentation and something on the skin, if we can stop it, because sometimes you cannot stop it. It's something that it's continuously, and you know that it will come. And one more thing. So
it's detection of early signs.
Yes.
And we have a problem because we don't have enough dermatology. Medicine. We don't have. So you think it can be like an app or something that that you can use
It take time, because I think that we understand. Sometimes when you're going to the sun, you say, "Wow, I am 10 and so sexy and so beautiful." Yes, but it will not be my tomorrow. So think about tomorrow.
So we should have a cover for the sun.
No, but we need the sun. This is important, and we need to understand that we need to understand not to harm our life.
Okay, so the question is the amount, how much exposure you're having to the sun and when.
Yes.
Okay, but when you talked about the scarf, you talked about how these scarves are being created in the first place.
First of all, it depends on the insult. Okay. If it's trauma, if I scratch the skin, if it's post-acne, if it's a car accident.
Oh my God.
So yes, but all this stuff, if can I improve the healing process of the skin is something that is huge. This is something for the future.
Okay. So would you like, I'm sorry now, I'm putting in more pressure about you. Let's assume now you're going now, you have to go to Haifa, I know, and on your way, you pick up you have someone is calling you, and on the other line is Jeff Bezos. And he's saying, well, Dr. Elman, I just heard what you said, and I think I'm going to give you, so whatever you need.
You need to dig down to the problem.
No, are you willing to put 10 years of your life for that now? If you have you have unlimited budget, you can do nothing.
Maybe. I need to think it over.
Because the second phone is going to be from the FDA waiting for you to put the papers.
I think that being a doctor is something that you need to share your working and to help people and to be assertive to things. But and when you're doing with the science is for everybody. Monica, and this is something special.
Last two questions before you go. If you wouldn't have been a doctor, what do you think you would have chosen?
Only a doctor.
Okay, if you haven't been in this field, which other field would you be?
Surgery.
Surgery. What kind of surgery?
I think, I thought at the beginning, but I think that surgery, I like surgery.
Doesn't matter what.
And in the next time, if we'll be next time.
Come on, we have one of the
Yes. No,
yeah.
I'll be a dermatology, but I'll make more surgery.
Okay,
Yeah.
you miss it. You miss it.
Yeah, I like it.
Yeah, you told me that you feel totally alive when
Yes,
you're in the
yes.
surgery. Okay. And last thing, what would you wish for yourself for the coming 100 years or 110 years?
To be healthy,
Yeah.
to be in good mental health, and to continue.
Continue
Yes, to
contributing
continue contributing. I'm not going on pension.
Yeah, okay. To humankind. No
Humankind.
pension. No pension for us.
Exactly.
Pension is only for the wicked. I'm joking. Don't take me seriously. It's been a real pleasure.
Thank you. Thank you so much.
Very pleasure. Thank you so much. And if you want to find Monica, so we are going to make sure that it's going to be, the podcast is going to be all over, also on YouTube, Spotify, and so forth. So we are going to put the links to the website of Monica, and I can assure you that the reason that I look so young, people keep saying me, is only because of Monica. So because I'm really 120. So so here we go. Thank you again.
Happy Hanukkah.
And happy Hanukkah for all of us. Thank you so much.
הרדיו החברתי הראשון. הכוח חוסר לאנשים.